Good afternoon and welcome to the next webinar in our series Bringing Data to Life. My name is Beth and I work at the Office for National Statistics. We're really delighted to see so many of you on the call joining us today for today's beginners webinar on wellbeing statistics. Before we start, we'd just like to remind you that all the webinars in this series will be recorded and they'll be available on YouTube after the event. The slides and recordings for our previous webinars are now available on the ONS website. Everyone who signed up to this webinar will receive a link once today's recording is available. If you're using the Microsoft Teams app and you would like to turn on live captions for this webinar, please click on the More button across the top of your screen. For those of you who haven't used this before, it's the button with 3 dots to the left of your camera button. And once you've clicked More, scroll down to Languages and Speech and then select the option to show live captions. With so many of you joining us today, the chat function is closed and all the questions will be facilitated through Slido. I'll cover this in more detail in just a moment. So the webinar series is for everyone. Please do share the recording and the slides when they're available and join the conversation on socials using the hashtag statistics for the public good. Lastly, you'll be invited to complete a short survey at the end of the webinar, and we'd be really grateful for your feedback on the webinar series and the statistics that we produce. Our next webinar is on crime statistics in April. We'll be adding more webinars as well to this collection in April, and they will be hosted over the summer. You can sign up to the next webinar by going onto the Bringing Data to Life collection on Eventbrite or by scanning the QR code that's on the screen now. The session today is interactive with some questions for you, and there'll be around a 15 to 20-minute Q&A section after the presentations. You can join this by scanning the QR code on your screen or heading over to slido.com and using the hashtag BDTL for Bring Data to Life Wellbeing. So that's BDTL Wellbeing. If you're also using the desktop Microsoft Teams app, you can click the Slido button at the top of our screen and Slido will appear. The Slido code will appear in the footer of every slide, so don't worry if you miss it. I'm really pleased to be welcoming our speakers today. So we'll first hear from Eleanor Rees, Assistant Deputy Director at the ONS for Wellbeing, Innovation and Productivity, who will share how we measure wellbeing at the ONS, followed by Harman Sagar, Head Economist for Arts, Heritage and Tourism at the Department for Culture, Media and Sport, or DCMS. He'll be sharing how the impact of culture and heritage on the well-being of individuals and society is valued, helping the government to make informed decisions and support policy making. Once again, really sorry for the technical delays in getting us started, but I will now hand us over to Eleanor.
Hello, just check you can see me and you can hear me.
We can see and hear.
Marvellous, thanks very much. So hello everyone, I really hope you're well. As I have been really kindly introduced, I am Eleanor Rees and I am one of the Assistant Deputy Directors of the Wellbeing, Innovation and Productivity Division. And today I'm going to talk to you about the work our Quality of Life team has been carrying out for over the last decade, and more specifically, how we have used the public's voice in our research and how important that has been. So in 2010, Dame Jill Matheson, our then national statistician, was asked by the then Prime Minister to develop a set of measures of national wellbeing and progress. As such, she launched the Measuring National Wellbeing programme. At the launch, Jill highlighted the importance of bringing the public with us by saying that to develop these measures, we must capture what people tell us matters most. So, how did we go around collecting people's voices? Between November 2010 and April 2011, we held a national debate where the questions we asked people included what things matter most to your life, what matters to national wellbeing, and how should we measure national wellbeing. We held over 175 events around the country, which were attended by over 7,000 people. The team worked hard to connect with as many people as possible across the public, businesses, public policymakers, and academics. People were also able to feed in through online participation, dedicated phone lines, prepaid postcards, and email contributions, as well as through media. It was really important to us to make sure we got input from all walks of life, and specifically we engaged with school children, those who had retired, charities, parents, young people, Gypsy Roma travellers, religious groups, hospital patients, carers, employers, government departments, academics and university students. And gathering everything people told us together, we had 34,000 responses. So before I go on to showing you what others said in the national debate, I wondered whether you'd be able to tell us, in your opinion, what you think is the most important for national wellbeing. So if you can log into Slido, if you haven't already, and pop in and just start typing away. I'm doing this assuming that you're doing it on your phones, but you could be doing it on your laptops. And let's see what you guys come up with. Yeah, fab. Okay, so we're seeing health come up as something that's really important. Purpose, overall health, connectivity, kindness. Wow, guys, you're doing a fabulous job here. Peace, work-life balance, the economy, education, green spaces, access to public services, child mental health. My gosh, they're updating so quickly. Social mobility, your job, your family, finance. Okay, we're moving on. Okay, so now you guys have come up with a fabulous list of things that are important to national wellbeing, and effectively everything that you said what raised. So in 2010, I've shared some quotes on the screen from our original national debate. So some of the quotes received included topics such as healthcare, our relationships, so especially highlighting our family and friends, food, books, music, sleep, wealth. But I really wanted to also highlight at this point that some people also raised that they thought that we couldn't actually quantify well-being. So what did the 34,000 responses brought together tell us? Okay, so they highlighted 10 areas of life that people felt were important. And these 10 areas of life created the structure of the Measuring National Wellbeing framework. These 10 areas were personal well-being, our relationships, health, what we do, where we live, personal finance, economy, education and skills, governance and environment. And in 2010, we had 44 measures representing these 10 areas. And the measures that we included were objective and subjective, meaning that we included measures that capture fact, such as whether you're employed or unemployed, and also opinion, so whether you're satisfied with your job. And through each of the areas, we tried to ensure we had a balance of subjectivity and objectivity. Other measures that we included in the framework at this point included having someone to rely on if you needed help, trust in national government, disposable income, feelings of loneliness, volunteering, unemployment, household waste that's recycled, and greenhouse gas emissions. On the screen is what we used to call the wellbeing wheel, and this was the first way that we used to share the findings. And although you'll probably agree that the colour coding could help you see whether there is or isn't change in the measures, you'll probably also agree that it isn't easiest to see what each measure is. And how we share and present our statistics was actually one of the areas that we reviewed in 2022. So as I said, in 2022, we reviewed the measures and how we present them. And this was especially important for us, as in the 12 years since the measure's inception, there had been many changes in the world. Not only the obvious COVID-19 pandemic, but if you think back to 2010, smartphones were only really just coming into accessible circulation and the norm for people to have. As with the original debate, it was essential to bring the public along with us and feed in what they told us was important to their and national well-being. This review was completed start to finish in 6 months. So we couldn't hold a national debate as we did previously, but had to make sure people's voices were still heard, and a diversity of voices too. We carried out an open consultation survey that we promoted over social media and at events for people to feed back into. We added questions onto our Great British Wide Survey, the Opinions and Lifestyle Survey, which was asked to over 2,000 people a fortnight, and we asked them what mattered most to their individual and community wellbeing. And lastly, we held focus groups with those who are more at risk of low wellbeing to understand what their drivers and barriers to high wellbeing might be. So what did people tell us in 2022? So on the screen is a chart of what was raised most frequently as important to respondents' individual wellbeing. As with 2010, family members and their welfare and physical and mental health came out clearly as important areas for our wellbeing. The next most frequently mentioned factor was our personal financial situation, followed by friends and community, then work and factors related to work. Although these are the topics that were most frequently raised in Great Britain as a whole, not everyone prioritised these in the same way. For example, mental and physical health was mentioned more by those over 70 than those aged 16 to 29, and good relationships and social interactions was mentioned more by 16 to 29-year-olds and less by those over the age of 70. And interestingly, we didn't see any differences between men and women. Now, during the review, it was quite clear that our users and the public wanted more comprehensive assessment and the measurement of wellbeing. I think we had something like over 600 recommendations for additional variables to include. But I'd like to ask you, what topics do you think were included in the 2022 set of measures that weren't originally included in the 2010 set of measures as a consequence of the review? Okay, fab, I can see you all popping measures in, and that's brilliant. Yes, you're right, and I'll come on to digital exclusion. So access to the internet, certainly. Yes, more on government, yes, technology, as we see coming through, finances, security, isolation. On the isolation and loneliness, that was actually one of the measures we had in 2010, but I hadn't put it on the original list, but I thought I would share that with you. Okay. Fab. Yeah, more on the environment. Fab. Okay. So if we move through, so on the screen, I have shared with you some of the new measures we included. So this isn't all the new measures we included, but I wanted to give you a bit of a flavour of the things that were coming through. So as I said, we had over 600 recommendations of new variables. So it's quite clear to us we needed a fractionally bigger set. Now, we didn't want to expand massively because at the end of the day, you still need to be able to interpret and bring all the data together to understand it. So we increased the number of measures from 44 to 60. So some of the measures that we included are hope for the future, community integration, satisfaction with public services, and this includes things such as our healthcare system, our education system, and the police. Hours of unpaid work. With digital, we included a measure on access to the internet, which incorporates both affordability as well as physical ability to have the internet in your area. Being treated fairly by society, satisfaction with our skills, renewable energy use, abundance of priority species, which is a metric linked to biodiversity, air pollution, water quality, and pro-environmental lifestyle. So this is capturing those who are making changes to their lifestyle as a consequence of environmental concerns. So I have now shared with you how we have used the public's voice to shape what we measure, but I also wanted to share with you how we've used it to shape how we present the data. On the screen is our refreshed interactive dashboard, which gets updated each quarter with the latest data available for our 60 measure set. On this dashboard, we've improved how we present the charts and narrative and present change over time. And this dashboard is available on the ONS website. It's available on the homepage, and it's also available on a wellbeing landing page as well. So the last topic I wanted to highlight in this presentation is personal wellbeing. You'll hopefully remember that this is one of the 10 areas in our national wellbeing framework. Now, this was the only area where we actually had to develop measures to represent the concept. And we worked with academics and others to develop these questions. And they're designed to measure people's thoughts and feelings of their life, covering 3 types of wellbeing. The first question asks, how satisfied are you with your life? And this is called evaluative well-being, as it asks you to consider your well-being over a longer period and in its entirety. The second question asks you whether the things you do in life are worthwhile. And this considers the flourishing aspect of our lives, a concept in well-being called eudaimonia. And the third and fourth questions are designed to measure hedonic or experiential well-being, which is short-term and then it's our positive and negative feelings. And we capture this through happiness and anxiety yesterday. And this area is essential for us to look at both positive and negative feelings, as the absence of negative feelings does not mean positive feelings, and the absence of positive feelings does not necessarily mean negative feelings. And we ask these questions on a scale from 0 to 10, where 0 is not at all and 10 is completely. So considering the questions that we've just reviewed, so this is life satisfaction, whether the things you think you do in life are worthwhile, feelings of happiness yesterday, and feelings of anxiety yesterday. At what age do you think personal well-being is the highest? So you should have 3 options available to you to cover the 3 broad age groups on Slido for you to have a look at and answer. Hopefully that's coming through. I can see lots of you are joining the Slido. Oh, I'm wondering if you guys have seen this analysis before. You're picking the winner. Well done, guys. Okay, fab. So if we move on to the charts, what you'll be able to see is that if we look at the average life satisfaction during July to September last year, we can see that life satisfaction is generally higher for those over the age of 65 compared to those aged around 20 to 60. I will note that you can notice that the scale looks a bit shorter. So we asked the questions on a scale of 0 to 10, and here we presented the data from 7 to 8. I want to just reassure you that the differences that we see between those aged 20 and to 60 and those aged 65 and over is statistically significant. So in reducing that scale so you can see the differences, we're not misleading you, that is a statistically significant difference. I also wanted to show you the data for anxiety. So again, following from life satisfaction, we can see that those aged over 65 reported lower levels of anxiety compared with those aged 20 to 60. So on my last slide, I just wanted to share with you an additional way that you can explore the personal wellbeing data. In the ONS, we have a tool called Explore Local Statistics, which allows you to look across a breadth of data from different topic areas, including our personal wellbeing data. And you can look at it at a local authority level and map it across the UK and compare that over time. On the screen, I've just screenshot a map and an overtime chart from this tool for Newport, as that's where our office is based, for you to explore. So thank you for listening to me. And before I hand over to Harry, I just wanted to add that the use of public voices in this research has been essential in ensuring that we measure what matters most and we capture holistic progress in the UK. And this research is not only being used in the UK, but also internationally to support other countries establish their own frameworks. So thanks, everyone. And I'm now going to hand over to Harry.
Thanks, Ellen. I assume everyone can hear me okay? Yep, I'm getting some thumbs up. Brilliant. Thanks so much. Yeah, and thanks, Ella. So yes, I'm Harman Saga. I'm the head economist for culture and creative industries analysis team at DCMS. My job title does change quite a lot, but also you heard Ella call me Harry. That's my nickname. So those who see me do feel free to call me Harry when you see me or talk to me over email. So Ella presented a lot of the advances that have happened in statistical measures of well-being, and those have been really moved forward quite quickly over the last few years. This section of the presentation is going to focus more on kind of the idea of how we measure the value of well-being and how that links to the underlying statistics. So this set of slides will be hopefully not too complex. I've tried to make it simple, but it's worth knowing we have other presentations that we do And if those are on LinkedIn, look at my LinkedIn. There's some very technical presentations we do on the work I'm about to present today, and we'll be doing some more in the future for those that are interested in more of the technical side. So on my first slide that you've seen for you is really setting out kind of what we're trying to do. So we know that the creative and cultural heritage sectors, they shape our cities, the towns, villages, and really create vibrant communities. But we also know they have a big impact on growth and well-being, and they create long-lasting impacts on the quality of life. However, what we found in the cultural sector isn't really an agreed way of how we measure these impacts and how we value those impacts, or what we like to call monetizing the value of those impacts. So putting all the benefits and costs, whether they're economic, social, cultural, or within the same kind of what we call unit of account, so all in pounds and pence. So this kind of idea came from the idea that we are very good actually measuring a lot of our economic impacts. For those who know some of the other stats on the growth side will know that our creative industries contribute about 124 billion in gross value added every year. It's about just over 5% of the economy. But we also wanted to make sure that alongside that, we could place the kind of express the social and cultural benefits of the sector as well. So that's why in 2021, we launched a program called Cultural Heritage Capital. It was very similar to Natural Capital, which set out our ambitions for our sectors to have some more guidance similar to the environment sector and the health sector and the transport sector to help people understand how they assess value for money and how they value those kind of what usually seen as more kind of intangible benefits. So that's really the aim of our program, is to monetize the economic, social and economic impacts of culture, creativities and heritage. So just for the presentation, I'm going to probably say culture rather than run through those three areas, because as those who work the culture know, there's always a debate on kind of how you bring those different definitions together. So it's worth saying, and the publication you can see there on the screen is one we published in December, and it's something I'm really excited about. It's something we've been trying to do for a long, long time now. And so one of the key aspects that we've looked at, building on the work that ONS have done, is how do we actually start putting a value on those health and wellbeing benefits? And this is work that's been done across government for different parts of government. We've looked at the data and the research and how can we do that for culture. So this led to us commissioning Frontier Economics, and they looked at the wealth of evidence that's appeared in the last few years, the last 5 years. That's been really kind of hitting in the kind of impact on the causal impacts of culture, and how we can then bring that into the health and well-being world and monetize those impacts as well. So if we have the next slide, thanks, brilliant. So the question you're probably going to ask is, why do we need to monetize these well-being benefits? So those who aren't aware, and I think you would have seen a lot of talk about this in the last few months, and the need to kind of show value for money of public funding. A lot of that, the way that we do that in government, is based on a publication called the Green Book. I would definitely, if you're interested in this, it's definitely worth having a look at this publication that Treasury have produced. It's been around for a very long time now, a few decades, if not longer. And it kind of basically provides all the guidance to departments how to set out their costs and benefits, and risks, and how those can assess how we make government interventions. And within this is what we call a kind of concept of social cost benefit analysis, which hopefully some of you are aware of. Effectively, it's where we stack up the costs and benefits and we work out what the net impact is of a program. So the whole aim of the Green Book is to really help decision makers understand the potential effects and trade-offs of different options, and providing kind of more objective evidence-based evidence effectively for decision making. So what the Green Book really sets out is a need to monetize all the significant costs and benefits that affect public welfare, which basically means we need to be able to put costs and benefits on the same basis. So in our case, monetizing means putting it into pounds and pence. Now the question then is, well, how do we do that for well-being? You know, this hasn't been done for a long time, and in the last 10-15 years it's really picked up pace. So that's been the challenge for a lot of departments, we're taking the work that the ONS has done and on how you kind of measure the change in well-being, how then do you get into the monetization. So Treasury and a number of departments in 2021 published new guidance on this, which is a supplementary guidance to the Green Book on how actually you start putting a value on well-being. As Eleanor set out earlier, there's a wealth statistics now that she's presented on wellbeing and change of wellbeing, but this guidance was looking at that level of data and how then we produce the impact and the wellbeing measures. It's worth saying, though, there are a number of wide set of other of data sets on well-being. Eleanor pointed out a few earlier, which look at different aspects such as life satisfaction, anxiety, happiness, and worth, and being worthwhile and flourishing. Now, those are then picked up in different surveys, different approaches, and different research, and really that's going to be based and focus on the kind of specific needs of the researchers and the organisations. So it's worth just remembering there are lots of these different ways, and Eleanor presented some of those, and a lot of those are used in the research world now to understand the impact of well-being, and we'll show now are now being used to kind of put the value on well-being. So what we are going to ask you is, how do you think cultural engagement affects people's health and well-being, such as by making art or visiting a historic place or a museum? It'd be good to use a slider and get your kind of thoughts on how culture affects health and well-being. Connection, great. Positive. I just like the word positive because that's what I think culture is. Purpose, inclusion. I think purpose is really good, and a lot of the work we're doing now actually is around purpose and people's attachment to their local cultural assets. Belonging is another one linked to that as well. Relaxation, yeah, we shouldn't forget. Culture is also about relaxation. We know relaxation has a big impact on people's well-being and health. Education, happiness, benefits, pride. Yeah, these are all fantastic words. These are all the words that we're bringing in to the way we're looking at it. So these are really, really good to see. I'd probably definitely take a snapshot of these, because I think this is coming up in a lot of our other work, and when we're trying to define what the impact of culture is, not just the well-being side. So great to see. Joy, yeah, really important word as well. We've got to remember that culture is there to bring joy and connections to people and expressing emotions. And it's worth saying some of those emotions may be positive or negative in some cases, because sometimes arts does have a different impact in terms of getting people to think about their kind of world around them as well. So that's fantastic. So yeah, so you're gonna see some more of these in the next few slides. So what we did, and as I put the paper that we published at Frontier, we worked with Frontier, and they also work with UCL on bringing this evidence together. So what we asked Frontier to do is to produce the monetary estimates on health and well-being. What we first had to set out, though, is what we meant by the kind of different ways that people interact with culture. The other publication we published in December was called Embedding Cultural Heritage Capital. That sets out a kind of a more kind of a definitional approach to how we define cultural assets, such as cultural venues, historic landscapes, digital assets, intangible heritage, which is very important as well. And we also had what we class as kind of cultural services, and one of those services is health services. And what we looked at with Frontier and UCL was what's the evidence telling us about those impacts from culture. Now, there are a lot more to unpack, and I think many of you have picked those out in the Slido, but the ones that were coming out of the literature specifically related to health and well-being were a reduction in depression and anxiety, reduction in chronic pain. And that chronic pain one's a really interesting area as well that we found new research on, where actually it's not just about the mental and well-being stuff. Actually, we found some work that actually shows there's a physical impact as well from that. Improved well-being, reduction in disease, and so there's lots of things in reduction in loneliness. There's lots of things that we looked at. Now, what we then had to do is work out, well, how do we turn that into a monetary value? So there are four kind of main ways of doing that. One is the avoided costs. So are you saving money to local health services? Then there's actually, by you being more, are you having higher well-being or high health, you'll improve your productivity. And then there's kind of two concepts that are used within economics. One is the quality life adjusted year, which is effectively the kind of what the value of having one extra year of perfect health. And a new concept that's going to come in the last 5 to under 10 years is the concept of a well-being adjusted year, a well-be, which I'm going to take you through now. And that's kind of what we've been trying to value along with the quality life adjusted years, because it's worth saying qualities and well-beings are very closely connected. So we took our approach to looking at both of those in our work. So that effectively is what our study looked at. Sounds easy, but then our next challenge is how do we value that. So what we'll set out the next slide, and bear with me on this, because this is where it gets a little bit more complicated, is actually how do you then do that valuation. So it's worth saying that with the Green Book, the way that we often do this is we go straight to that kind of very economic way of thinking about, let's put a pound and pence on it. Now, it is worth saying that's not the only way that you should bring your evidence on well-being, and it's really important to use all the data that Eleanor, the underlying data Eleanor presented, is going to show what the impact on well-being is of any kind of investment or sector. But also, actually, there's a whole set of other quantitative and qualitative data that's produced, and a lot of people who are what's called practitioners will have a lot of that evidence, which is also quite important to put alongside any kind of economic approach in terms of valuing well-being as well. So the way that we do this, and this comes into like the first kind of pink box there on my slides, is you first start off with the need to estimate the change in well-being, and Eleanor's presented a little bit on that in terms of different ways of doing that. And what we've done in a lot of our studies is take that survey data, also connect that to wider research to kind of effectively understand and apply that to understand some of the causal effects of a specific intercultural intervention, and seeing how those well-being, how that well-being data changes. So what Treasury introduced in 2021 is this, and with a lot of academics and a lot of consultation, is this concept of a WellBe. So WellBe stands for Well-Being Adjusted Life Year. So it's a way of consistently measuring the value improvements in well-being. So WellBe is calculated from assessing a person's self-reported life satisfaction. So that's one of the scales that Eleanor introduced. So on a scale of 0 to 10, where 0 represents not at all satisfied and 10 represents completely satisfied. So what's interesting, a change in a 1-point change, so going from 7 to 8, is classed as a 1 WellBe. Now, what's interesting is that 1 WellBe is worth £13,000. What you'll find actually in the literature is when you're looking at the changes in those scores, they're not moving by an entire point. They're often moving by decimal points, so 0.2, 0.3. So what you'll find in a lot of the research is a 0.1 change in life satisfaction is kind of equates to about £1,300 in terms of well-being value, or what we like to call welfare public value, effectively. So that's a very quickly how we do it. There's a lot more mechanics under the hood, but what's really good about this well-being value is it kind of gives us an all-encompassing valuation approach and method to apply across well-being data. And what's also interesting, it kind of sits now alongside the quality life adjusted year, which some of you will know is kind of been well established within health economics and the health sector. So we now have kind of two ways of kind of tackling the same kind of evidence thing on terms of valuation. So we're going to move to another Slido question. So the question is, how much do you think the wellbeing value is for organised activities related to art, music and theatre for 18 to 16-year-olds? So we've got a few options there on how much we think once we've done the valuation that value will be worth. So I think it's a multiple choice question for this. Okay, interesting. Okay, great. So we're going 3,000. Oh, it's equalising. I'm sure my statisticians will probably tell me that there's actually we're this is quite nice seeing this live. So I think we're settling on actually 3,000, over 3,000 and 1,000 kind of being the favourites at the moment, with just over 1,000 coming in. We might equalise by the end of this. So that's really good to see. Now, I'm not going to reveal the answer to that straight away. I'm going to put up a slide, and I'm really apologise. This slide is a little bit dense, but because I wanted to show you what we've been able to do. So we effectively developed over 10 models. Some of them have additional parts to them, where we've effectively, as I said in our earlier slide, we've tried to value the individual impact, so the quality life adjusted years, or the wellbeing impacts, the impact on NHS and social costs, care savings, and the productivity impacts. So the one that always draws everyone's eye when we published this in December was the last line on the charts, which is the general engagement by adults aged 30 to 49, and that showed that there was a £992 per person impact of general engagement with culture, and that was cultural activities such as visiting museum, galleries, and heritage sites, of about £992. When we extrapolate up to kind of what the current engagement levels are for that age group, it came to around 8 billion in total in terms of the impact on society. Now, what's really interesting, it's worth saying, a lot of these models, they do need a set level of dosage. You obviously can't just do things once to get a health and wellbeing impact. There's definitely a number of times you need to effectively engage with culture. And that's probably one of the biggest changes we've probably made, is actually there's much more of a line kind of drawn in terms of how much you need to engage for those benefits start coming through. And also that needs to be in some cases continuous engagement as well. The other line which I've highlighted there is the impact of cultural venues on depression in older adults, and this was valued at 314 per person and a society benefit of 3 billion. So this model valued both the health, cost savings and productivity impact. So those ones I've highlighted are using the quality life adjusted year measure, and a lot of that was looking at mental health, which obviously, if you saw on the other side, links into the kind of higher level of impact on well-being. And that was really encouraging. But the next slide I want to show you is specifically on the kind of the well-being side that we did. So some of those models had to use qualities, as I said, some of them had to use well-beings. So the first line to draw your eye to is looking at the organised activities such as music and theatre for young adults aged about 18 to 29. Now, the measures that we used in this was, I think, flourishing, and that was one of the areas that Eleanor mentioned early on. So this finds a kind of impact. I think this is where those who picked the second answer B got this right. The impact on this specific area on well-being is about £1,240. The impact on society is 0.3 billion. Now, it's worth saying that number is smaller than the other numbers, the kind of society impact, mainly because smaller number of group of people, but also there's a higher kind of test here for engaging. So this is kind of regular engagement, which also shows you in the way that this can be used, as if the more people who engage, the higher that kind of societal impact will be. And that's why it's so important to ensure that everyone has a chance to engage in these cultural activities. The next model, which is the two lines called music and art self-esteem, this was looking at the impact of those activities on people's self-esteem and then their impact on well-being. And that was valued at £134 per person and 122 million, or 0.6 billion and 0.12 billion in values. These look quite small, but this is again dealing with a much smaller cohort of people. But it is really encouraging, and this is all areas that we want to do more work on. One of the areas, and you'll see there's not NHS cost savings list. One of the areas we also want to look at in the future is getting much more of that work done. So this is really cutting edge work for us, and it's not really been done before in this way for the cultural and heritage sectors. So this helps us kind of understand that value. Now, why this is important, as I said, it's really important because this type of evidence linked to the stats as well that Anna presented starts creating a story of impact and really starts creating the evidence that you can use in, say, funding bids or making your case for how culture has an impact on society. Here, we presented specifically on health and well-being, but our wider program looks at lots of other things. At the moment, we're doing a project on cultural education, but also we're doing some work, which I haven't covered here, which is on how you measure the growth impact as well, which should all be added together, basically. All added together because it'll all be in pounds and pence. So that's where we think the big impact will be, and it really allows us to take something that is seen as a sector that's seen as all the words you put on the Slido, but then trying to turn that into kind of pounds and pence and numbers, which we really hope that can help people make their case for funding in culture. So that's it from me, Bethan. So I'll hand back to you.
Brilliant. Thank you so much, Harry, and thank you, Eleanor, as well. Really great presentations, and thanks so much for everyone who's taken part in all of our Slido interactions today. We've now got some time to move on to questions for the rest of our event. We've had loads of great questions coming through on Slido. We will be answering the most popular questions first, although we'll try to balance those out so Eleanor and Harry get to answer them equally. So please do give a thumbs up to any questions. I'd also just like to flag that any of the links that you've seen today, although you won't have been able to click into them, you will receive an email after today's event with a link to them. If we don't have time to get to your question today, the ONS Engagement Hub inbox is always open, so please do get in touch with us, and you can email us at engagement.hub@ons.gov.uk, and if your question is one for Harry, we can pass those on to him too. Okay, so without further ado, we will move on to our questions. So, most upvoted question through Slido is, where did you get the figure of £13,000 for a wellbeing from? So, Harry, I will pass that one to you.
Yeah, hopefully you can hear me. That is a really good question. I'm just pulling up my answer for you. So this the wellbeing number has come from quite a lot of different angles. So what we have in the supplementary guidance and green book, which will probably explain it a lot better than I can. It's always good to read because these are really technical things. Is that it's effectively the midpoint value, and it basically does bring, as I mentioned, my thing, they're very much related. The quality and the well-being are related. And so it comes from a couple of things. It comes from looking at the quality values, which I don't have to hand now, but also it looks at some income life satisfaction research that was done, which came up with a value of 16,000. These are effectively kind of looked at together to come up with that value. That's the simplest explanation I can give you. But broadly, that's what. So there's a number of research papers that fed into that value. One of those was by Fritters et al. 1999 and then in 2021. So effectively, that's how we've done. Bethan, because it's quite a long, I don't want to get lots of data in here. I can post that answer specifically and give people the direct link on that. But it's effectively that kind of triangulation of different studies and values where it's come from.
Excellent. Thanks, Harry. Yeah, we can share that in the email after today's event with links. Okay, so our next question is, how do we benchmark our data against other countries, and are there any regional measures? I don't know, Eleanor, if you want to come in on this one, if there are any regional.
Yeah, I can come in on this one. So against other countries, there's a couple of options you have available to you. So the Gallup World Poll collects the life satisfaction data. They don't quite answer the question in exactly the same way we do, but it's the same principle. It's a life satisfaction question on an 11-point scale as we have. And they collect that for many, many, many countries. And that data feeds into a report we call the World Happiness Report. And that then looks at life satisfaction for all countries, and you can compare that way. Also internationally, the OECD, they have their own How's Life report, and they also collect data from across OECD countries on holistic well-being, and where they will look at the factors of life very similar to us. So again, they look at subjective well-being like life satisfaction, but they'll also bring in data on things like our employment, underemployment, health, our relationships, and they collate it together from internationally comparable sources, and that's on their website. Then on regional data, that is really important to us. So yes, as many of the measures as possible are able to be disaggregated on a regional level. Now, our dashboard at the moment only has the capability of presenting our data at a national level, but you will see right at the bottom of our dashboard, there's a nice green box that says see data available with the dashboard. And if you click into that, you'll get an Excel spreadsheet. And for every measure where it's possible, where we update that measure, we'll also provide you with country and region level data. And where possible, that data is also fed into the Explore Local tool. So we do have it available for as much as we can there.
Brilliant. Thanks, Helena. I think the next one is maybe perhaps not one we can answer, but it says, it looks like working is bad for your well-being. Is this symptomatic of how we do business in the UK? We should see what we can do to improve business culture. I don't know how.
I can approach a little bit of the start of the question. I can't necessarily answer for businesses in the UK, but I presume that this is relating to the age analysis that I showed. And I think one of the things that we should bear in mind here is taking a life course approach. So think to yourselves, if we've done the research and we've already shown that employment, health and relationships are the things that are most important to our personal well-being reporting, consider over your life course how things change. So we know during the Middle Ages we might be becoming parents. Yes, we are working. We might be seeing our parents going to ill health, or we might have to provide caring responsibilities. And we need to consider this as a whole across the life course are the many factors that might be driving our well-being in this space.
Thanks, Helena. Also, I think the next one may be for you. So at what geography level is the data available? Is it only available for England, or can it be broken down to a UTLA or LTLA level?
Yeah, so that's me again. So the lowest geographical data that it is available is an LTLA level. So it is the lower tier local authority level, for those who might not know what that acronym is. And it is available for the UK as a whole. Now, one of the fabulous things that my predecessors did in the team is really advocate for the personal wellbeing questions to be added onto as many surveys as possible. So from an ONS perspective, our UK survey goes down to an LTLA level, but it's not just our sources that capture the data. So for example, Northern Ireland has the questions in their continuous household survey, breaking it down to their local government districts. Scotland has similar data available, as does Wales. So in the national survey for Wales. When it goes to the measures of national wellbeing, so these are the 60 measures we discuss, due to some of the data sources, not all of those are available down to a local authority level. Generally, regional is about as good as it could get right now, but it doesn't necessarily mean over time it can't be done if we're able to aggregate everyone's answers together, but that might be a little while off.
Great. Thanks, Eleanor. I'm going to pull out a question for Harry, which I just had. Is there further guidance available on applying the wellbeing method to an organisation's project?
Yes, so the wellbeing method at the moment, the main guidance for that is the Treasury's supplementary Green Book guidance on wellbeing. I must admit it is very technical, so it's definitely worth, if your organisation doesn't have analysts, to kind of reach out to people, economists, stuff that they do that. But that effectively is the main guidance at the moment. There's lots of other research papers out there, but that's the one I would start with. What you're going to need, though, to apply the wellbeing approach and those values, though, is you're obviously going to need to have that data behind it, which is the questions and the surveys. Then look at it. It's also then important, you need to then obviously understand whether it's the thing that you're implementing that's actually changing that wellbeing number. So that's kind of the research methods of kind of looking at the causal impact on those wellbeing changes on wellbeing. But this is all set out in that guidance as well, and I would definitely start with that guidance. It's probably not as well known to people, but it's a really fantastic piece of work, and there's a lot of work in that. If you want to know some more on that, though, the link, which will be in my slides, and the work that we've done, has a lot of additional guidance and practical stuff in terms of applying it as well. It will be for culture, but the principles still apply for other sectors as well.
Perfect. Thanks, Harry. A question that I think we've had threaded throughout is around children and whether we consider the well-being of children in what we produce. Eleanor, perhaps one for you.
Yeah, absolutely. So one of the things I didn't mention when we were discussing the original debate was that it was really clear. I think I did say that we did discuss it with children, but it was really clear that what matters to adults isn't the same as what matters to children. So probably I should have made clear that this framework is what we use to represent adults, which is 16 and overs. But at the point of our development of that framework, it was quite clear that we couldn't just bring in children and adults together and it's separate. So actually in 2014, we developed a separate framework for children and for adults. So what I've shared with you is adults, but we actually have a separate framework for children. This framework we actually reviewed in 2019, or over 2019-20, and redeveloped the measures again. So we do consider children's well-being, but we do so separately to adults in a separate publication with measures within the similar domains to what we have for adults, but in metrics that are appropriate for children. So we'd look at things like happiness with school, which is obviously something we don't really capture for adults. We'd also look at things like happiness with their appearance. Sorry, appearance just slipped from my mind then as I went to say the word. And also when we ran the review 2019 and 20, one of the things that came up quite strongly was autonomy and voice. So we do measure, have a metric now for children on that within our framework.
Thanks, Eleanor. I'll ask two more questions. One quickly, can you remind us what those three types of happiness were?
Yeah, so these are three types of subjective well-being, which we call personal well-being. And they were evaluative well-being. So this was life satisfaction, where you look overall over your life, how do you evaluate your life? Then the second one was eudaimonia, which I call flourishing, because it's a word you can get your mouth around a little bit easier, which is basically, do you feel the things you do in life are worthwhile? Are you flourishing within your own definition there? And then we have affect, and which is also called hedonic well-being. And this is like the short-term how did you feel yesterday? And it's really important in that way, as I said, to have the positive and negative feelings. So that's effective hedonic well-being.
Brilliant. Thanks, Eleanor. Okay, and the last question I'll slightly pose to the both of you, if you could just wrap up. So really interesting to see what is measured, but how can wellbeing statistics be used by people? Is it a nice to have? And perhaps, Harry, if you could touch on like what is it that you want people to take away on the call today, and what is it that they can, how can they use the information that they've gathered?
Yeah, so I think so I think there's kind of 2 points on that. One is, I think what we've seen in the last 10, 15 years is a bit of a revolution. So one of the important things is the reason obviously people like me and Eleanor like stats is because it then sits alongside other stats such as economic growth, and we can measure things on the same basis and have the data there to kind of prove the impact. On the valuation side, what's really important, as I mentioned in my presentation, is we are very keen on measuring the growth impacts, but also we want to make sure that we measure all the other impacts as well. And the really important thing there, it allows people to take some of these more kind of social benefits and put them on the same basis as kind of the other kind of not so easier to measure and monetize, but that you kind of have been traditionally easier and a lot of investment in measuring things like growth. So how people would use this? So a lot of the work that we are doing is for one, I think, so people can understand actually a lot of the funding that's going in, say in culture, actually is having tangible impacts on people's lives. Also for local people in community groups to have this data and this evidence to hand to help them. And one of the things we want to make sure is that these things are technical and costly to do. So our project is trying to kind of help people kind of take that off them and give them the evidence they want back. So the real important thing for us on this work, and I was presenting actually only last week on this, and the important is that we also want to hear what people need and what evidence they want as well, and what will help them kind of make their case for culture or other types of government as well. So that's where I think it can really help. But I think what it does give, and a lot of work, to be fair, is pointed towards lots of funders and people who are making decisions, but it is there to help people also understand that they're getting value for money from their investments as well.
Brilliant. Thanks, Harry and Eleanor, in a few words.
So how can it be used by people? So I think Harry's given a good explanation there of how we can use it from like an analytical perspective, and we use it to track things over time. But one of the things I also wanted to raise is that from the measuring national wellbeing perspective, we provide a framework that people can use to holistically consider their decisions. So it helps and support people as a framework and a tool that people can say, well, actually, how will this decision impact me from a social perspective, a subjective well-being, a health and environment, a personal finance, education and skills, where we live. And it can be used not just to monetize, not just to track, to benchmark, to pre and post test, but also as a framework for people to consider holistically how we are doing, how decisions impact us. And that is actually outlined in the Green Book as well. It's considering not just the financial benefits of it, but also how you consider it as a whole from a more social perspective.
Brilliant. Thank you both so much. That brings us to the end of today's session. So thank you to everyone who has joined us today, everyone who's asked any questions. As mentioned, if you have any further questions, just pop us an email at engagement.hub@ons.gov.uk. Before we wrap up, I'd just like to flag that you can attend other events in the series or other ONS events on Eventbrite. You can follow official statistics producers on social media, whether that's LinkedIn, Instagram, X, or other platforms. And you can also respond to our consultation and engagement questionnaires, which are opportunities for us to really understand what users' needs are from our outputs. And lastly, you can sign up to email notifications to get the latest wellbeing insights straight to your mailbox when they're published. If you are also selected for a survey, we do really value your time and responses so we can gather really meaningful data across the UK to better understand our society. Before you go, we'd really appreciate if you could just share your thoughts through our survey, which is also on Slido, but we will share a link to this as well via email. So thank you both so much, Eleanor and Harry. Thank you everyone for joining us today, and we will see you at the next event. Bye-bye.